Hello everyone, welcome to another episode of Let's Talk Health. Today, we have with us Dr. Tinu Lukose, consultant nuclear medicine. Welcome, doctor.
Thank you.
So, doctor, can you provide a brief overview of the principles and the technology behind PET-CT scanning?
Yes. So basically, PET-CT is an imaging modality which is quite commonly used nowadays, which is most commonly used for oncology indications. PET-CT comprises both PET imaging and CT imaging. The PET imaging basically makes use of a radio tracer which is injected into the patient's body, and this radio tracer emits radiation which are detected by the detectors surrounding the patient's body. Also, we use a contrast enhanced or non-contrast whole body CT scan, which helps us in localizing the diseases in where the PET imaging shows a metabolic activity, higher metabolic activity or higher concentration of a specific receptor. So this is a basic imaging principle. The PET image makes use of makes use of the radio tracer in detecting the functional anomaly in the patient. And also the CT image basically makes use of the anatomical localization of where exactly the functional anomaly is happening in the body.
So how is PET-CT imaging different from other imaging modalities like MRI or ultrasound?
Yes, the other radiological imaging modalities like MRI, ultrasound or even CT scan, they are basically anatomical imaging modalities. In general, MRI has some functional component as well, but in general they are anatomical imaging modalities. They make use of, for example, in case of an MRI, they make use of radio waves or radio waves to detect the patient anatomy based on the changes in the patient's body by radio waves which are projecting through the patient's body. In case of an ultrasound, they use high frequency sound waves to detect the patient anatomy using a ultrasound probe which is placed on the patient's body. Ultrasound is most commonly used in guiding the physician to specifically diagnose a disease or to guide some interventions like biopsies and all. In case of PET imaging, the PET imaging has the functional component which is actually differentiating from these anatomical imaging modalities like CT or MRI or ultrasound. So combining the PET imaging with the CT imaging actually helps the clinician to accurately diagnose the disease in cases of cancer and also for exact staging of the disease. There are some other reasons for which a PET-CT is done, like neurological indications or cardiology indications, where the metabolism part is only imaged. So this is actually the difference between the MRI and other anatomical imaging modalities.
What are the main clinical applications of PET-CT imaging in nuclear medicine?
As we all know, basically the most common indication is oncological indications. PET-CT helps in diagnosing a disease, diagnosing a cancer, the staging of the cancer, and it guides the clinician to accurately localize the cancer and to guide a biopsy from the disease. And also it helps in treatment planning. In cases where the radiation treatment is required, the radiation therapy planning can also be done using a PET-CT. And PET-CT is also useful in assessing the treatment response. And in some cases, surveillance can also be done using the PET-CT.
So, doctor, could you just describe the process of preparing a patient for a PET-CT scan? And also, are there any specific considerations or precautions for them?
Yes, the PET-CT scanning, there are specific precautions which are needed. You cannot walk into a PET-CT center and do a PET-CT scan by request, because you need certain specific precautions, you need certain drugs to be stopped, you need certain specific physiological conditions before a PET-CT scan is performed. For example, the most commonly performed PET-CT procedure is an FDG PET-CT, the fluorodeoxyglucose PET-CT scan. In that case, we are using a glucose analog. So the patient's blood glucose level should be at a specific level less than 200 for exactly before the PET-CT scan can be performed. So patient needs to be fasting for a duration of approximately 4 to 6 hours before the scan procedure is performed. In some other cases where a different other tracer is used, for example, gallium labeled PSMA or gallium labeled daughter Tate or daughter Knox. In that cases, you need not have fasting, but you need to have at least a 2-hour window before we have a food or water, because in every cases of PET CT, we are also doing a contrast enhanced CT. In most cases, in some cases where the renal condition is not that good, we are not doing a contrast enhanced CT, but still we are going for a contrast enhanced CT. If we are going for a contrast enhanced CT, the patient needs to be fasting for 2 hours. In some other cases where a neuroendocrine tumor, for example, if suspected, in those cases where if the patient is taking some medications, or in cases of Parkinson's disease, if the patient is taking carbidopa or some other medications like that, then it needs to be stopped prior to the scan. So before getting a PET CT done, the patient should actually visit the nuclear medicine physician and ask what all medications can be continued, what all should be stopped and all. So also where in cases where pregnancy is suspected, or if the patient is breastfeeding, there are some precautions for us that as well. If the patient is pregnant, we cannot do a PET CT. And if the patient is breastfeeding, we ask the patient to stop breastfeeding for some amount of time before she can resume feeding the baby. So all these precautions needs to be kept in mind before we go for a PET CT scan.
So doctor, how do you ensure patient safety in the procedure? Because especially there's a case of radiation exposure.
Yes, radiation exposure is the most common, most important thing which we should consider before going for a PET CT scan. Because radiation exposure is there in both the PET component and the CT component as well. So before going into the scan, we properly communicate the procedure with the patient, which is very important. Also, we will ensure the patient's renal status, the hydration status, etc. Because when we inject a radiotracer into the patient, it is excreted mainly via the kidneys. So if the hydration of the patient is not that good, so the patient will be continuously getting radiation exposure from the injected radiotracer. So we actually promote the patient to drink more and more water immediately after the radiotracer injection, and also after the scan. So mostly the scan is performed approximately 1 hour after the radiotracer injection, and also we ask the patient to be very much cooperative with the scanning technician, because any movement during the scanning or any unwanted problems which arises during the scanning might lead to a repeat scanning, which will lead the patient to have more and more radiation exposure. So that is one main concern. Other than that, reduce the radiation exposure to other patients, other people, and the caregivers and other physicians. We ask the patient to maintain a little bit distance from other persons, especially their caregivers and other children and pregnant women in their household, for a period of approximately 6 to 8 hours. So these are the most common procedures we use to reduce the radiation exposure to the patient as well as the caregivers.
What are the common radiotracers and what are their clinical applications?
The most common radiotracer which we use during a PET CT is F18 labeled. F18 is actually a positron emitter labeled fluorodeoxyglucose. It is actually glucose analog. This is the most common radiotracer which is used for oncologic indications, mainly for oncologic indications. This can help in detecting the site of the cancer, the site of the metastasis, the staging of the cancer, basically the staging of the cancer, the treatment response evaluation, and also for the therapy planning and surveillance of the patient. Some other radiotracers like gallium labeled daughter Tate, both are comparatively similar. These are useful for specific indications like neuroendocrine tumor imaging, like pheochromocytoma, gastroenteropancreatic neuroendocrine tumors, medullary thyroid carcinoma, etc. Other tracers like gallium labeled or F18 labeled PSMA is one of the most common tracer used for imaging prostate cancer. Then there are tracers which are being developed for imaging in certain specific indications like insulinoma. Then some other tracers like F18 DOPA for imaging of brain tumors or Parkinsonism. Then there are certain tracers like N13 labeled ammonia for imaging cardiac perfusion, etc. There are multitudes of tracers which can be used during a PET CT for multitudes of indications. Each tracer is different. Each the use of the tracer for each indication will be different. So patient preparation needs to be according to the which tracer we are using and the which indication for which we are using it.
So like any other process, PET-CT imaging will also have its challenges.
Yes.
Elaborate on them.
Most important challenge, as I have mentioned before, is the radiation safety. We have to ensure radiation safety to the patient as well as the caregivers, and also the technicians and nursing staff which are involved in the scanning. So basically, we ensure adequate communication with the patient and the patient's caregivers beforehand, because that needs to be the first thing. Because anything which we do out of the way, the procedure which is not common to the patient or the patient bystanders or even the staff, nuclear medicine staff, it can lead to multiple problems, like the most importantly the unwarranted radiation exposure. So basically, we communicate with the patient in terms of radiation safety, to ensure radiation safety to himself and as well as others. And during the scan, there might be certain problems. During the scan, certain problems might arise, like there might be motion artifacts, like the patient might be moving in between the scan. This can lead to multiple time exposure of the patient to CT scans or PET scan. We have certain devices to reduce the motion artifacts, like the system or the software itself can correct to some extent the motion artifacts. And but if it is not that well corrected, then we'll have to go for a repeat scanning procedure. And some other challenges include the availability of the radio tracer. As I have said before, you cannot walk into a nuclear medicine center and ask for a specific scan on the same day. You need to be prepared. Certain radio tracer needs to be imported from outside. Certain radio tracer needs to be prepared on site. So that requires certain time and certain preparation. So these are mostly the challenges which we face on a day-to-day basis.
So as we all know, PET-CT imaging is one of the modern technologies. So are there any advancements or emerging trends that you find exciting or promising for the medical science?
Yes. The most recent exciting thing about PET-CT is that currently we are doing a PET-CT in different sets. Like the patient will be undergoing scanning for a period of approximately 10 to 20 minutes, depending on the scanner. The scanner might be having a 1 ring of detectors, 2 ring of detectors, 4 ring of detectors, etc. But currently the latest development is a person's complete body can be scanned within a single field of view. The patient need not to be moved in between the scan to adjust the field of view. That seems to be the most exciting thing currently coming up in the field of nuclear medicine. And also newer and newer radio tracers are under development and are coming into the market. So this provides greater confidence to the clinicians in diagnosing a certain disease and even treating certain diseases. Thank you.
So with that, we conclude today's episode. Thank you so much, Doctor, for your valuable information. So with that, we wind up today's episode. We'll be coming with another topic the next day. Thank you all for watching.